Hello, Franklin. Um, this town hall meeting is going to be about vaccinations. There's still a lot of unknowns, and I'm going to start right out at the beginning. This is almost like a news show, um, where you have your stories already, and then something breaks right beforehand. I just want to see why someone sent me a text to see if it's one of our guests saying that they can't arrive. Anyway, it wasn't. So, so as I knew what I was going to say yesterday. I know less what I'm going to say now because of the governor's announcement that he's going to go to um, allow anyone 65 and over and anyone with medical problems to be tested now. So I was unprepared for that, and the county is trying to figure out figure that out themselves right now. Um, but it is my understanding that the governor or the state will be sending out 95,000 appointments. Exactly how that's happening, I don't know. But it's all for people who have signed up at the website covid19.nj.gov, covid19.nj.gov, covid19.nj.gov. And there's a red banner there. You click on that, and it's the way to register there. Um, exactly how they're picking which 95,000 of the people have signed up, other than over 65 and have indicated certain problems. I'm sure there's more than 95,000 in the state. I don't know. So I'm on the county health recovery task force. I'm reading, I posted something on Facebook a couple of days ago. I'm going to basically read for that because I'm sure not everyone is on my Facebook page. So far, and this is still valid, the county has requested 4,000 doses. They've received 2,500. They've been administering to date to the first responders. The rules just changed today, and they're going to. I don't want to speak for them, but to see how they would adjust. We were hoping that by the end of January they'd go on to 1B, but again, everything changed today. They are not holding second doses. They are the governor, the state is holding second doses. So it's important that only one group holds the second dose. If everybody holds the second dose, then you're only getting out a quarter as much with 3 levels. So you have to coordinate that. And the big bottleneck is that the dosing. I wanted to be, it's important to me that at the county level, the county is going to be giving out the doses. The county will give out some doses. The state will do it at the mega sites, and ShopRite will be doing it as well. There's 2 ShopRites in Somerset County that will be doing that. If you Google ShopRite COVID vaccine, you can find out that information. And I'm going to say you can sign up on their website, but I just checked that out, and I was told I had to wait, and there were 16,000 people in front of me. I'm not kidding, literally. So there's high demand for this, and yeah, and everyone wants it now, and I understand that. I get that. But unfortunately, it hasn't been manufactured. We can't manufacture it locally. The state can't manufacture it. The pharmaceutical companies need to manufacture it, distribute it, and the states need to distribute it. I saw a article in the New York Times. They listed the 4 best states and the 4 worst states. We were in neither group. North Dakota was doing the best. Connecticut and forget if it was Virginia or West Virginia were second, and South Dakota was 4th. We weren't in the worst group either. I understand the hospitals are not doing a great job at distributing. Um, and the state may be taking back some of their vaccines. That's more of a rumor I've heard than the truth. Um, Eventually, when the county gets enough vaccine, they're going to open up satellite sites. And those satellite sites, one of which will be in Franklin. It looks like it will be at Quailbrook. We do not have access to the state site yet. So you register at covid19.nj.gov. We're expecting, and when I say we, the county, not the town, the county is expecting to have access to that. We were hoping today, if not tomorrow, but this week, so that we can download the people who are there and come up with a way of contacting the people to schedule appointments. A lot of people have asked about volunteers. If they want to volunteer, the way to volunteer, if the county needs volunteers, is going to be through the MRC, Medical Reserve Corps. And if you go to mayorkramer.com, mayorkramer.com, and look under January 10th, there's a link there about volunteering, and that'll get you to the link to the site where you can volunteer if you have particular skills you think the county will need. A little bit about vaccine rate, what we need to do in Somerset County. This is back of the envelope math. There's 330,000 people in Somerset County, roughly. If you were to, well, Labor Day has been floated around as a goal. I'll be conservative and say the goal on Labor Day would be to have herd immunity. Herd immunity, at the low end of herd immunity, is that 70% of the people have been vaccinated. So 70% of 330,000 is roughly 230,000. There's around 240 days from now until Labor Day. So you do the math and you do that. There's 2 doses per person. You're talking about 2,000 doses a day. Since we won't get as much vaccine initially as we need, it means you really have to be able to do 2,500 a day. Right now, the county can do 1,000 a day. They're doing more like 500 a day. They have the capability of doing 1,000 a day, which is okay for now because they don't have enough vaccine as it is. So, but that's going to have to be ramped up. I'll let the county commissioners talk about their plans about that. For Franklin, that would mean 500 vaccines distributed, or doses, shots in the arm per day. So we have some ramping up to do. It's my goal to make it so that the distribution in Somerset County and in Franklin, is not the limiting factor. The limiting factor will be that how much vaccine we get. And that's something I personally have no control over. That's really what I have. I see Director Robinson is on. She may be on with she's maybe in another meeting and have that device hooked up to us, ready to flip from meeting to meeting. But I'll take questions now, and she'll come on when she can.
Okay, so if you all want to go ahead and put any questions in the chat on Facebook, I'll draw them from there for the mayor. A couple of things, I think you covered them for the most part, but real quick summary: number of signups, can you pick your vaccine, and any opportunities to volunteer?
So the volunteer is, again, go to mayorkramer.com under January 10th. I talk about volunteer. I have a sheet that I wrote out. Actually, I stole it from the county and made some edits to it. And there's some links on there to figure out how you can volunteer at the Medical Reserve Corps. Can you choose your vaccine? I doubt it. when I got vaccinated, I showed up and whatever they had, I took. Hospitals tend to have more likely Pfizer, but I got mine at a hospital and I got Moderna. Because hospitals and big organizations are more likely to have the refrigeration or freezing that's capable. So Moderna is going out more to people that have less refrigeration capability. It's kind of becoming Moderna's more the default because it's easier to handle, but it's going to be show up and get what you get. What's important is your second dose is the same product as your first dose. And then there was a third question.
Yeah, there's question about the total number of signups.
At the state, I don't know.
And then there was a follow-up question on volunteering of whether or not there was any indication of whether volunteers would, their preference for people with medical skills, or it wasn't a question of that.
So the commissioners will talk more about it. I think they're going to be hiring an organization that will have all those skills, but I would still start working if you have medical skills. I would sign up for the Medical Reserve Corps in case. There's going to be, as time goes on, there's going to be more vaccine coming, more larger variety of vaccine going out. And it may be because of the slowness that the vaccines are coming out, that my estimate of 2,500 is low. And it may be that most of it comes out late. So you've got to, but it's going to come out a lot. So you can't predict. A lot of people want to know when this is going to happen. And so do I. But we don't know. We don't know when manufacturers are going to make what they're going to make. We don't know what the federal government's going to give the state. We don't know what the state's going to give us. And we don't know how many 65-year-olds, well, we probably can figure that out, but we don't know how many people have COPD. I saw smoking was on the list. Heart disease, obesity. There's probably estimates out there, but then how many of those people want the vaccine? There's still a lot of people who are afraid of it. I disagree with them. It's your personal choice, of course. I think the risk of COVID far outweigh the risk with the vaccine. I'll repeat, I know I'm getting off the questions. I'll repeat what I said during the interview that the Franklin Reporter did when I got vaccinated. It is impossible to get COVID from the vaccines that are out so far. Is the mRNA vaccines, the mRNA vaccines, you cannot get COVID from them. Maybe from the person giving you the vaccination, but not from the vaccine itself. And the next two that are coming up are Johnson & Johnson and AstraZeneca. Those are both adenovirus vaccines. While you will be getting a virus, that virus has one tiny bit of it that is from the COVID. And it's not like they had COVID and the adenovirus in a vial together and they picked out the right ones. No, they programmed the adenovirus to look a little bit like COVID so that you would build immunity to COVID. So you cannot get COVID from any of the two current vaccines or the likely next two, the AstraZeneca and the J&J vaccines coming up. I got off topic, but.
Yep, so a couple of things, Mr. Mayor. One was somebody was curious if, I know it just came out today with the over 65, but was there any indication whether there'd be priority for people of, who are well over 65 as opposed to, kind of just 65, or is it just sort of a blanket opening?
I don't have the details. I read a kind of a press release from the governor's office. I didn't see that in there. I had to read it quickly because it kind of just came out. I see the deputy director blinked on for a second. we should give the Franklin Reporter a time here too.
Yep, absolutely.
Yeah, I'm here. Just give me a second, but I'm listening and my other meeting is done.
Okay,
So you want to open it up to the Franklin Reporter and Advocate before Executive Director Robinson's presentation?
Yeah,
sure. I mean, I have a question.
I just
And
have,
she did mention in the chat that currently they have Moderna as the one. So maybe Bill and PJ, if you all want to jump in there, let me just take this off of Spotlight here.
okay.
Yes, sir.
I just a quick. I didn't catch something, Mayor. You said you're talking about satellite sites. You said one would be in Franklin. Did you say it looks like it'll be at Quailbrook?
That's what the county initially talked about. It's a county property, yeah.
Oh, the senior center.
Yes,
No, that's different than Colonial Park.
I never said Colonial
No,
Park.
you never said Colonial Park, but I thought we had seen something from the county a week or two ago saying that Colonial Park was going to be. Maybe I'm just foggy. I could be wrong on that. But Quailbrook Senior Center, you think is the Franklin satellite area?
Well, we have the deputy director here. I mean, the director, sorry.
Executive Director of the Somerset County Commissioners, right? Does that work for you, Executive Director Robinson?
Director is fine. Good evening, everyone. To your question, Bill, we were exploring sites in different municipalities. And what was reported in the paper was Quailbrook. But certainly to that end, we have purchased 3 vans that we're currently getting outfitted so that we can take the show on the road and do mobile testing and vaccination. And currently today we actually did testing in vaccination in Bound Brook. We're still on 1A. I know the governor made his announcement today to move on to those in 1B that are 65 and older and with certain conditions. And as I heard the mayor report, part of the problem is scheduling. We as a county and a provider do not have access to that system as of this hour. We were told on yesterday that we would have access as early as today, but definitely by Friday. So as soon as we get access to that VAC system where they are notifying over 90,000 people who are currently registered to get an appointment, and how that will work is once we as a county entity or provider gets access to that database, which we had to preload a schedule for the state, and then those people who are pre-registered will get an appointment. They will be notified from the state. If you registered in that VAC system, you would be notified by email. So they didn't tell us when that was going to be done. So I don't know if that's today, tomorrow, but that's how those who are pre-registered in the VAC system will be notified via email.
And Bill, to your question about other than specifics of older than 65, or I don't see anything in what came from the governor's office, and I just forwarded you an email that they had sent to me.
Yes, it's based on that availability. Certainly, if there are slots available, what we have run into is we're currently doing 300 appointments a day, 3 days a week. We have not filled every slot. I mean, one day last week, we actually had over 70 some odd people that were a no-show. So they did call today, said that there was a mix-up in communication from their facility with our facility, and these were long-term care facility workers. However, if someone fits into the category and they register and we have a slot available, I would dare say that if it's available, we wouldn't turn anyone away.
Director,
Yes.
Just a follow-up question on something. So when you have someone with an appointment, so a person, say, of advanced age who wouldn't do well standing in line for a good amount of time, that sort of mitigates that with the appointment, or what have you seen in terms of?
No, But still will recommend them to register. If that means they need to register on site, then if there's a slot available, I certainly strongly encourage any and everyone that wants to be vaccinated to schedule. Otherwise, we may run into situations, as you've seen on the news, like in Florida, people waiting for hours and then being turned away. Right now, as the mayor had mentioned, we are dealing with supply and demand, and certainly the demand is outpacing the supply.
And when do they get their appointment for the second vaccine? Does that come subsequent in some fashion?
Subsequent, yep, subsequent. So you'll be scheduled, yes, you will be scheduled, saying that your 28 days are coming due, and we make sure that those who are already had their first dose will be guaranteed their second dose. It's all about being good stewards.
Okay. Sorry, Bill and PJ, do you all have any additional questions?
PJ, you're muted.
You're muted.
I don't know how that happened. Okay, can you hear me now?
Yes.
Okay. What I was going to say is the issue of matching, that your first dose is Moderna, your second dose also must be Moderna.
That is correct.
Okay, and so that, let's say the first wave of Moderna vaccines, like Mayor Kramer, has already been administered, and 3 weeks from now, there isn't a Moderna. There's only Pfizer. Is that ill-advised? Or would a patient then need to wait for Moderna to be available again? I mean, that's probably a far-fetched question at this point, but it could happen.
It could.
So I would say it's ill-advised. Dr. Kramer, as a physician, can chime in from a medical perspective, but I would say that would be ill-advised. But being a good steward and having good logistics and administrations in place, then you shouldn't come against that problem.
Yeah, I mean, look, there's going to be a lot of missteps. Hopefully that won't happen in Somerset County. Will that happen anywhere in the state or the country? I bet it will. I personally would say no to the second dose. I'd rather take my chances and wait a little bit more.
Exactly.
You would be the first person on the planet to go from one to the other. We have no idea what that would do.
Okay.
Might
That's
be-
fundamentally where I was going with that, which then led me to my next question about the primary differences between the ones that are being offered right now, between the Pfizer, the Moderna, the AstraZeneca, and the new J&J. The only primary difference that I'm aware of so far is the J&J is a single dose, whereas the other three choices do require second dose.
Yeah, I mean, there's the J&J and the AstraZeneca are adenovirus, so it's a different technology that you're getting it. But yes, that is one of the main differences is J&J is a single dose, because that's how they did
That's
their
how they formulated it.
Yeah.
But their effectiveness is not impaired by single dose versus double dose.
J&J hasn't released their single dose, their effectiveness numbers, so I don't know. They said they're going to do that late January, early February. We'll just have to see.
And this is the other reason why scheduling is so important. When you are managing the appointments in your clinics, when you have those with dose 1, and then you're making sure that you have your inventory on hand, you're scheduling out for dose number 2. At some point, we will be overlapping where some people, as they're rolling out the different categories, you will be giving first doses as well as administering second doses. So then that becomes a challenge because you have to have them inventory for both, what you're scheduled for and what you're scheduling out for your second dose.
Exactly.
And I guarantee you there'll be times when you're giving out a first dose of one brand and a second dose of another brand. So I implore people to, when they get a dose, they know what dose they got.
Yes.
And when they show up at the other for the second one, I'm going to be asking, is this Moderna? Because I got
Mhm.
Moderna the first time, and it's conceivable they could have Pfizer. I'm gonna be asking that question.
Yes.
Are there any
Well,
records?
that was one of my questions to your point, Dr. Kramer. For instance, what if I went to RVCC and got dose 1? For whatever reason, I get sick, I end up in the hospital, and it's time for my dose 2. There's no coordination of care, but yet I'm adamant that I want my dose 2. How does that work?
Yeah,
You'd have to know what your dose 1 was, but wouldn't there be, I mean, are the sites keeping records so that when you come back for dose 2, they pull up your card and they say, oh, you got Moderna, so here you go.
Yes, as long as you're going back to the same site.
Right.
But what if you're somewhere else?
Well, then you gotta make sure you go back to this.
Ooh,
Well,
boy.
it could be computerized, right? I mean,
So there's no
Mhm.
central database
Well,
that they're
Mhm.
going into.
No.
to enter.
that's an issue, is it?
Yeah, the fortunate thing is right now, the state has Moderna. And to Dr. Kramer, Mayor Kramer's point is at some point, in which we don't have a choice, what we receive, based on what we see.
so as you covered, I work at JFK, but I got my shot at Raritan. They're part of the same company I work for. And so I went over there because they had vaccine available. And when I came back, my boss said, oh, well, you can get the second shot here. And I'm not going to do it because that I know that they're going to have a shot for me at the same place that's going to be Moderna. I'm not gonna mess around with that, even though that both sites are doing Moderna. So yeah, don't play around with that. Go to the same place. Because you forget to ask, they assume, they think you're here for your first shot and they
Oh,
give you
boy.
something different and now you're a guinea pig.
Mhm. Well, each patient needs to be his or her own advocate, that's for sure.
Yeah.
Maybe there's some sort of an identification card that could be administered after dose 1 with name, date, other pertinent information, and the vaccine itself, so that it can be presented the next time and a healthcare professional can match.
You get that. I could run out and show you
Okay.
mine, but it's roughly credit card size and
Mhm.
it says the brand and it says the date you got your first one and an appointment for the second one. So
Mhm.
you know, it's not like vital you keep that, but I kept it. I took a picture with my cell phone. So
Mhm.
I guess I could try to find that. And so that I won't lose.
Are they getting their appointment for the second one upon receipt of the first one, or is that coming electronically to them?
So where
You
I
did.
did it, I got the appointment. I made the appointment right when I got it.
That's not necessarily is that what everyone will experience, Director Robinson?
That's the recommendation, so I don't see us veering from that. But certainly we can do reminders, and I believe the VAC system will also give you reminders.
And do you know how they come? They take the information when you register, right? So that could it come by phone or text, or do we know?
Right.
Okay.
I haven't gone into the system to see what all data points that they're collecting and how that will be regurgitated back out or go back with the two-way communication to the end user.
Gotcha. And if there is a question on here, somebody's asking if they encounter problems with their registration or something like that, would they go back to the registration site for a contact for any problems?
I can't tell you for what happens from the VAC system because we don't have access to it. Still some unknowns. But once you know which location you're scheduled for, I know for the county, we will have a number. And I expect that the state will have a number where you can call to field, where they can field questions or FAQs.
Just needed a clarification on that Quailbrook thing. That's Quailbrook Golf Course, right? That was what the press release said. The satellite location for Franklin Township's Quailbrook Golf Course.
Yes, but we're still working through the specifics.
Okay. And those
That was one of that was one of the locations that were identified.
right.
But until we're able to schedule out, like we said, we're doing 3 days a week right now. But until we have that inventory and be able to schedule more aggressively, we're just gonna have to take it week to week.
Okay, and you don't know when that's gonna happen? You don't know when Crowbrook's gonna come online, right?
No, I do not.
Okay, those vans, when are they gonna hit the road?
We're pushing them for an aggressive timeline if they can get it back to us within the next 5 weeks. They were talking 6 to 8 weeks, but we're trying to push for a 4 to 5 week turnaround time.
Okay.
So just to,
And, I just, one other thing, did you, Director Robinson, did you mention something about no-shows? Did I hear you say something about no-shows for the appointments for the vaccinations?
Yes, last week we had a few no-shows. The miscommunication, it was for a facility.
Has that been an issue historically as you've been given these vaccines?
I have
Have
to
you had a-
excuse myself.
Across the,
So sorry.
across the state, it had,
Kids in one thing and then dogs in the other. No, I'm talking about Somerset
So-
County specifically.
we have had a couple of no-shows, but I know you had asked a question via email last week, and I
Right.
apologize for not getting back to you, getting ready for the reorg.
Sure.
But we are not in a position where we waste. You do have a 5 to 6 hour period once you constitute the vaccine, but we are carefully looking at how we're doing our refrigeration in that constitution. So we have not had to waste, and our goal is not to waste. So we also, as a county, invested in a refrigeration system because we didn't know if we were getting Moderna or Pfizer. So we are prepared to receive both. We currently have cold refrigeration and cold storage. So when we're moving it from our cold storage facility, we're able to have it in a cooler. So when we take it to the test site and keep it at the proper temperature, which is a little bit less complex than you with the Pfizer.
Right. Okay. So, is that refrigeration system that the Somerset County has, is that common? I mean, because I remember I read that there's an issue with distribution of the Moderna vaccine just because that sort of deep freeze refrigeration system wasn't readily accessible wherever people would want it. So is this something unique for Somerset County, I guess is what I'm getting at.
You said.
It is.
Pfizer.
The deep freeze is for Pfizer, not for Moderna.
Pfizer's-
But we had planned.
Mhm.
Yeah, we were anticipating whichever one we received. So we got ahead of the curve and we ordered that deep freeze refrigerator. So we were prepared to receive Pfizer if that was the vaccine of choice.
Mhm.
And how many doses can the refrigerator hold? You know?
Off the top of my head, I do not remember,
Okay.
but it's quite a bit.
Okay, and once they're open, and supposing you get a bunch of no-shows one particular day, you've thawed out the vaccine. You can put it back in the refrigerator, back in the cold storage. How long does it last in that state?
It has to do with the constitution of it, and maybe Mayor Kramer can speak to that. But usually the recommendation is 30 days. So what we're doing, we're not taking them all out. Say if we have 300 scheduled for one day, we're not taking all 300 out at the same time. And
Okay.
that's why scheduling is very, very important.
Yeah, I don't know the nitty gritty of vaccine distribution, so I can't tell you how long it lasts.
So Dr. Reddy assured that we have a cooler that we take to the site versus the storage versus the container that we bring and have on site. That way we're not wasting,
So
because I know that's a big concern.
you got the big freezer in one location where you have all the vaccine. Then before you go out, you take your cooler, you put the vaccine in the cooler, then go to RVCC or wherever the site is, right?
Right.
And are these vans going to be equipped with these refrigeration systems?
With the coolers, absolutely.
Okay.
I have a few
And
questions.
today we were
Go ahead.
Today we were in Bound Brook. Next week we're scheduled to be in North Plainfield. So we're just waiting to see if we're getting our other doses. Our first dose that we received were a lot of 500. Our second shipment we received were 2,000. In which we asked for 5,000 on that second shipment and received only 2,000. So that gives you an idea of what that inventory is like, or how the vaccines are being distributed to the different providers. This next shipment, we're expecting 1,800, but that could change. And right now, there's a delay in us receiving that third shipment of 1,800.
Okay. And you're doing first responders now. You're doing 1A still, right?
We're still doing 1A. The governor just announced with the 1B.
Right.
So we will move accordingly. But again, we don't have access to that system to know who in our county is in that 1B category, or that 65 and older, in order to schedule them.
Okay. And when are you going to be in Franklin? Do you know?
I do not.
Okay.
We have it scheduled out, but again, it's based on what inventory we have. So we can't move to the next site until we have inventory on hand. I think that would be a mistake to schedule out just because you have the ability to schedule out and then not have inventory on hand to put the needle in the arm.
So you're not going to tell me when you've preliminarily scheduled it out?
We're prepared to do 3 days a week, but again, we're stopped in our tracks right now because we don't have that inventory that will put us, say, 3 weeks out. We don't have the inventory to say that we can schedule 2 months out.
Okay, so, okay.
Yep.
I just have one.
It's all contingent upon getting the frequency and the amount of inventory that we need. And as you can hear, we got 500, we got 2,000, and now we're waiting on 1,800.
Okay, go ahead, PJ, and then I'll go to the feed.
Yeah.
And if you all have any other questions, just stay on and you can chime in when you will.
Sure. This goes back to the keeping of the same vaccine for dose 1 and dose 2. Is it possible for a community to request that if they start with Moderna, that is the shipment that they will receive there on out? Is there any control on that? Therefore guaranteeing that dose 1 and dose 2 will be the same.
The plan is that with whatever you have, that number that you've done your dose 1, you will be guaranteed that number for at least your dose 2.
Okay.
So the problem then becomes when you start merging both giving dose 1 and dose 2 at the same time, because on any given day, somebody could be coming for dose 2 and then somebody else could be coming for dose 1. So it becomes an administrative and logistical
Challenge.
Challenge
Yes.
and great planning.
Yes.
And some people are of the mindset, just give out all that you have and then worry about the rest on the back end. I'm not of that mindset. Dr. Reddy is not of that mindset, because we definitely want to make sure that we have enough for dose 2 as we're doing this rolling schedule and being able to keep up with the schedule that we presented to the state.
Mhm.
I agree.
So I have a number of questions coming in off the Facebook comments feed. And I know some of these may exceed your ability to answer them. I know that the Somerset County Commissioners and the Mayor's Office are both trying to get as much information out as possible, but you can't give what you don't have, right? So a couple things. One is for people that cannot travel currently, they may meet the criteria but can't get to a location site. Is there any plans right now on how to get vaccines to them if they're, say, kind of restricted at home or that kind of thing?
Yes, so that's part of the question that I was answering for Mr. Bowman.
Okay.
Once we have that inventory, because we are going to take the show on the road. Like I said, today we were in Bound Brook, even though we were only vaccinating 1A group. Next week, we're scheduled for and have inventory in stock to go to North Plainfield, so forth and so on. We have the mobile vans that we purchased. There's been discussion that we should go to senior centers or senior communities that have clubhouses. So it's not just a RVCC or just, so we're
Right,
looking to
right.
meet people where they are, yes, and working with all municipalities in the county to identify where we can take the show on the road.
Oh, great. There's a few questions about that, so that clears that up. And then a couple other things is there, right now you have been saying that supply exceeds demand, correct? Currently? No.
Demand exceeds supply.
Demand exceeds supply. So then in that case, if there, because I remember you said there were some no-shows, but still demand exceeds supply. So what about any thought to 24-hour setting up for like extended hours, or there's a question about that. I guess that's happened somewhere else.
Not at this hour, but today we did meet with and looking to do a private-public partnership, public-private partnership, where someone has the staffing to be able to do this, whether they're able to do 24/7. I don't have that information at this time, but certainly if you do 24/7, I know people work all different hours, different shifts. There's a question that come up, why are we doing teachers or nurses in the middle of the day and they're teaching? So that's being taken under advisement.
The task force has discussed that, and the 24-hour thing, Israel is doing that, but that's because they managed to get the supply. If we have enough supply that there's not enough hours in the day to give it out, then I would be advocating that we start going for long hour distribution. And when we have enough supply, we, as the director just said, we want to do some off-hour distribution so people don't have to choose between work and getting vaccinated.
Yep. I think you beat me to the other question, Director Robinson, but it was with regard to the public-private partnership. There was a question about whether or not pharmacies or other organizations might be offering vaccine at some point. Anything you would add to that?
Yes, the state contracted with ShopRite, and there's 2 in every county. And so the 2 in our county is one in Hillsborough, is the one that's closest to Franklin Township. And the other one, where's the other one, Mayor Kramer, is it Bernards or Branchburg?
Lynchburg, I think. Yeah.
It's north of the county. They didn't give a rhyme or reason why they chose 2 per county, or specifically the 2 that were chosen in Somerset County. The one common factor is that they're off of state highways and easy access to the interstate.
And you mentioned
Because the mayor
backlogs.
did advocate, the mayor did advocate and say, why not the ShopRite in Franklin?
And Director, just so you know, when you talk to the state, I tried to get on the ShopRite site just to see, and they told me I had to wait in line, and I was number 16,000 something in line. Not kidding. So,
Oh my,
Wow.
yeah.
Yeah.
wow.
The demand is there.
It's going to be this way. If manufacturing has not kept up with the manufacturing distribution hasn't kept up with the initial expectations.
Demand.
You know, I heard, someone said warp speed is going at a snail's pace right now. The development went quickly, but there's been a lag in the production.
Right.
And, as the
Yeah.
director and I have made a pact with ourselves that we will not be the bottleneck. And we can't help the supply bottleneck, but she is working hard, and I'm there on the task force working that we can make sure that we can push out whatever we get in a reasonable amount of time.
So
That
again,
is
for all
correct.
those questions in the feed about more than 3 days a week or 24 hours, again, it's about the demand isn't, or the supply isn't there to warrant those extra hours.
Right.
And that is
Okay,
correct. Not at
You
this
got enough
time.
time to give out what you got right now.
And as of today, as of tomorrow, when we close out our test site, based on what's scheduled, we would have administered 1,588 doses. So tomorrow is another 300 scheduled, and we've only received the the 2,500. So we're doing pretty good. And that's only the 1A that was scheduled.
There are a couple questions about people with concerns about allergies, allergic reaction, that kind of thing, and precautions. Anything you can share with regard to that?
As part of the vaccination site or sites, there will be a staging area or waiting area that you have to be monitored for a certain amount of time. If you are at a high risk, then we're going to extend that waiting time before you are at least released to leave the site. But there is a waiting period once you've been inoculated. And we have staff on site to deal with anybody that goes into anaphylactic shock or EpiPens and things of that nature. So we're prepared.
Well, I'm told that the county is doing it very well, that you're in your car, they write on your windshield, am I correct? The time that you got your dose, and someone is there looking at the windshields, and when the 15 minutes have gone by, they come and say, you know, okay, and they wipe off the windshield and you can go.
That's correct. And I will be at the test site tomorrow to see the operations firsthand.
Okay. I think we're about there. I'm rolling back to see a lot of questions came in. Just want to make sure I didn't overlook any. If you still have a question that hasn't been answered, you can re-enter it so I can catch it at the bottom of the feed. I'll give it one more minute.
Well, I would like to thank Mayor Kramer for doing this. Certainly, we want to make sure we get the information out there. We will be doing PSAs and looking to get information as it becomes available on government access or public access channels. So more to come on that.
And I'd like to thank the director for coming on, giving us her time. We discussed today at the task force meeting that we need to start doing this countywide. Obviously my interest is Franklin, but if someone in Boundbrook gets it and isn't vaccinated, that they can spread it here. So it's important that we get as big a region around us going, and that's what we're devoted to.
Well, I would like to ask a question about efficacy, because 1 dose versus 2 doses. As many people know, our Congresswoman tested positive for COVID. She's a cancer survivor. She did get 1 dose back in December, but she tested positive. So what do you say to anyone that's concerned about the efficacy in taking a vaccine and those type of scenarios?
Well, look, I've gotten 1 dose, and I'm looking forward to Valentine's Day because I'll get my 2nd dose on February 1st and give it a couple of weeks, excuse me, and then I should be up to speed. So that's why I think 1 dose isn't enough. I mean, Bonnie Watson Coleman is a good example of that. And by the way, come Valentine's Day, I'm still going to be wearing a mask. I'm still going to be keeping social distance. I'm still going to be bathing in Purell 6 times a day. It's, I've got a wife who won't be vaccinated, so I don't know when. And God is my witness. I'm not bringing it home to her. So I'm going to be very, very careful. And careful of people I work with and the people I work with in the town. So just because you get vaccinated doesn't mean you're bulletproof and do whatever you want. Have you heard any more about the Congresswoman? How's she doing?
No, she's doing good. Her symptoms, she said, is just like very mild. It's as if she has a cold. So the last time I was in contact with her was yesterday.
Great.
Well, we're all keeping her in our prayers.
Will do.
We have a couple of questions. Like one, Mr. Mayor, do you have plans for some town halls to continue to give vaccine updates? And there's also an interest in town halls for other township matters. So do you have any plans or thoughts on that?
Yeah, so I will be giving more town halls. I can't predict when. You know, there's been a lag in town halls because while there was a huge amount happening in that more and more people were getting it, there's nothing new, no grand information I could give out. I'll have town halls as information comes out. Right now, to be honest, I'm not planning town halls on non-COVID related things. While, you know, we're doing the business of the town, that's where my main energy is going. And I don't want to distract from that. I'm still answering pothole questions and email and looking at a litter
There's no
question.
pothole town hall coming up,
Mm,
Mr. Mayor?
Not right now. My focus is on COVID. But if you have questions, mayor.kramer@franklinnj.gov.
So, Mr. Mayor, just, and perhaps Director Robinson, there's just a question about time between doses, and does that differentiate between vaccines in terms of the time between the first and second dose? And that's pretty much it.
So Moderna's 28 days, Pfizer is 21 days between doses. J&J will be a single dose when it comes out, and I don't know the AstraZeneca time.
Okay. So varies between. Yep. And I think there's a number of questions that we'd answered earlier in the town hall. So I suggest that people, once this thing is posted, it'll be up on Facebook more or less immediately, and I think the town will have the recording up on the town website, so you can go and review back to see what you missed. But I think, with your permission, Mr. Mayor, maybe just thank the Franklin Reporter and Advocate, and thank you, Director Robinson from Somerset County Commissioners, right? And thank you, everyone who tuned in, and hopefully we'll do it again soon and keep people well informed as you all always have. Mr. Mayor.
Thank you, and for having me, and thank you, Mr. Mayor, for doing this.
Absolutely. Thank you, Director. Thank you, Franklin Reporter. Thank you, Michael, as always. Be well, Franklin.